Good evening, guys. My name is Jennifer Carew, and this is my proposal on the purchase of King Vision Airways for ambulances in Caldwell County. This proposal is meant for the EMS division chief, the EMS director, any kind of supervisors or training division staff, and also the county commissioners. As most people know, in the pre-hospital setting, which is the setting that ambulances function in, the intubation success rate is less than that of the hospital setting. Obviously, that makes sense. In the pre-hospital setting, we're not electively intubating people. We are intubating people who are in imminent distress, whether that be cardiac arrest or it be a rapid sequence induction due to some other underlying cause, whether it be imminent respiratory failure or potentially a trauma-related incident. Currently, we're using laryngoscopes and, of course, your endotracheal tubes to intubate patients. When you're doing that, you're using your arm to take your laryngoscope handle, you're placing it in the patient's mouth. Most of the time, you're manipulating that head back and lifting up on that jaw. Now, you're going to have to make sure that you're not using your hand as a fulcrum and fulcruming against those teeth, potentially causing breakage to those teeth. But you're going to have to be down on the ground with your laryngoscope handle into the patient's mouth, not in their mouth, but right at their mouth. You're going to take that handle, you're going to lift up to see those vocal cords, and you're going to have to physically look and see those vocal cords. Now, that's the method that we're using right now when we have to intubate a patient. What I want to talk about is King Vision. King Vision allows you to move back from that patient. What it is it's a video attached to the laryngoscope handle. So you can tell this is going to be kind of a different technique involved. That's where the training division comes into effect. With King Vision, you're going to place the laryngoscope in someone's mouth. You're going to be able to see their vocal cords. And you're going to take that endotracheal tube and you're going to pass the tube watching the camera. So you won't have to have your mouth, you won't have to have your face all the way down near that patient's mouth. And you're also not causing a lot of trauma. You're not moving your hands. You're not manipulating, trying to see it based on your eyes, when you can tell this is not a straight line from your mouth to your vocal cords. But when you're intubating someone, you're going to have to make it a straight line. You're going to have to be able to see those vocal cords unless you have something like King Vision. All of your ERs are already using a video laryngoscope. Most of ERs are using a GlideScope. This is a big tripod that sits right here, and it attaches to a handle, to a blade, and they're going into the patient's mouth, they're looking to the side, they're watching, and they're passing the tube. And they're using their big screen monitor to pass that tube. This equipment would allow us to be doing the same thing in the ambulance. The difference being that the King Vision is small, it's portable, and it's more fitted towards EMS. We don't have room to be carrying a large tripod around so that we can see this large screen. It's going to be a screen about this size, and it's going to be directly attached to the handle, which the handle is disposable, the screen is not. You're going to be able to dispose that handle with every patient, making sure that you have a sterile blade each time that you're intubating a patient. Now, the reason this is important is because in these situations, airway is important. In EMS, it's ABCs. Aside from massive hemorrhage that we control first, airway is going to be your most important. Without an airway, people die. So when your paramedics are intubating, they're intubating because this person's in imminent distress. All the odds are stacked against them. Most of these people are vitally unstable. These are not elective innovations. These are people who are critical. So if we're taking care of critical patients, we should have every piece of equipment available to ensure the best patient outcome. What King Vision is doing is it's allowing us to provide less trauma into that area, and it's allowing you to see and visualize that endotracheal tube go through the vocal cords. Now, the average paramedic is intubating about 3 times a year. That's 3 intubations. This is a procedure that's done for the average paramedic. I want to say that again, 3 times a year. This is a high-risk procedure. But with this high-risk procedure, it's pertinent. There's a high advantage to being able to secure someone's airway. This is an important part in the medical field. Without being able to secure someone's airway, their breathing and their circulation is not important, because people die if they don't have airways. So I believe that King Vision is a life or death, because without this piece of equipment, some medics may have to resort to the failed airway protocol, where they're either doing cricottomies, or they're placing a blind airway device. These are not ideal situations. This type of equipment is going to ensure that we're giving the best care possible to the patient. The best care possible to a patient that needs to be intubated is for them to get intubated in the least amount of time, with the least amount of trauma, to provide oxygen to the lungs as fast as possible. King Vision is going to allow you to view that endotracheal tube passing through the vocal cords. That's the gold standard. They want you to view it going through the vocal cords. This piece of equipment is going to be a life-saving device. It's going to make a difference in Collicksville, in your places that are far away from the hospital. It's going to make a difference in those people's lives that are not electively wanting to get intubated, that they're getting intubated in imminent situations. The King Vision is going to allow us to take care of people's airways fast and effectively.